Welcome to one and all. Myself, Dr. Tarun Prashant. Today's class is going to be on examination of ankle and foot. So here are two pictures, one to your left and one to your right, which are showing two different spectrums. One in which you can see that the foot is lying completely flat on the ground, to the other in which the foot is having some sort of a deformity wherein you can see an increased space on the inner aspect of the foot. So why does this bother us? This bothers because the foot is the most important part of our body which helps in locomotion. It is the weight-bearing portion of our body, and any problem with the hip or knee can be compensated in the feet. But when there is a problem in the feet, the patient will have a difficulty in weight-bearing, and due to which the alteration of gait will play a huge difference for the patient. So being painless or painful will determine how early the patient comes to us. So what are the factors that come in when you're going to see for a patient with a foot or an ankle issue? So it always starts off with age. It starts off with presentation. It first starts off with whether the patient can speak to us or not. So almost always when we are going to deal with congenital deformities, it always involves the parent or an observer who observes the feet and tells that there is an issue. Whereas there is another spectrum wherein there is an issue, be it a trauma or be it some other infection or any other cause which has caused a disability to the patient at any point of time. Or it can be in old age where there are few other changes wherein the patient says that slowly he is developing into an issue. The second being pain, which is the most important factor because it affects the person's daily living. Third thing being a sudden appearance of a swelling. Fourth, a deformity for a very long time. Fifth, causing a change in the activity while limping. And sixth, instability when you're going to do recreational and sporting activities. So let's dive into each of these points in order to know how or when do we see these patients and what their diagnoses are. So coming to the age, most often congenital talipes equinovarus is found out at birth. It's found out due to the abnormal position of the feet when the child is born. It can be found out either by the obstetrician or by the pediatrician or even by the patient, as in the child's mother or their relatives, wherein they say that the foot is turned towards the inside. So at birth, most commonly it being congenital, whereas in case of talipes equinovarus, due to another cause, be it due to polio or due to any other neural tube defects, might occur at a later stage, wherein it might be seen at 3 months or 6 months or later. Whereas most often congenital vertical talus is more noticed once the child has crossed the initial period of infancy, following which we find out the deformity. So not all congenital deformities are found out at birth. Coming to pain. So there are two types of foot pain. One, a pain which is going to affect a person when weight bearing, or two, a pain which is also going to be at rest. So a pain which is going to be affecting his walking has a duration. So knowing whether a patient is having a pain following an injury or following a period of fever or following a period of any other cause which might be polyarthralgic, multiple joint, and all of that will determine how long the patient is having pain. So the duration of pain makes sense because if a patient is going to present to you with acute pain wherein he is unable to weight bear, it is more predominant or leading towards an infection, or in case of an aggressive tumor wherein the patient is suddenly having severe pain and slowly notices a swelling wherein his pain tolerance is very high and he is unable to take the pain into his consideration, and that is going to lead for you to know that there is going to be an active disease which is involved on the inner side. The next, the site of pain. So almost always the site determines what the diagnosis is, because it tells you whether it is a soft tissue, or is it a joint issue, or is it a bony issue. So almost always a clear-cut question on where the pain is, how it occurs, gives you a thought into what the probable diagnosis is. Next, the type of pain. Whether it is going to be radiating, whether it's going to be neuritic, all that determines on what the diagnosis can be. The character of pain mostly being throbbing or a pricking type of pain, should mostly think of a undulant infection which is going to be on the inside, whereas something like a rest pain more goes in terms of a malignancy. So radiation in case of feet pain or in patients with pain in the foot, you need to ask a clear-cut history on where the pain is, whether it's traveling from the knee towards the foot or from the foot towards the sole. So this will again determine the level of injury, whether it being a nerve which is being compressed, wherein there might also be an altered sensation in the feet, or it can be due to a tendon which is going to be inflamed, which is going to cause a pain along the action of the tendon. So aggravating factors of pain, almost always weight bearing, will tell you whether the pain is going to be due to loading, or relieving factors such as analgesics might tell you that there is an inflammatory process wherein the pain is getting reduced. But no relieving factors is something to be worried about. Diurnal variation and postural variation is something that needs to be asked to the patient, which will determine whether there is a change in the path of pain during these times. Night cries in case of tuberculous arthritis.